much. Let's get on. And we have a guest speaker here today. I'm thankful that Arvin had the time and the availability to provide us some background and answer any questions we may have. Dave Thompson is going to introduce him. But I'd like to mention that Arvin Venkat, a lot of folks on this call know Arvin well. He's a Democratic candidate in the 30th Legislative District, my home district, Pittsburgh, right outside of well, Pine Richland and all that, Pennsylvania House. Arvin is a graduate of Harvard University and a little factory down the road, Yale University School of Medicine. So I'm excited to hear he's going to tell us and meet with us today. Welcome, Dr. Venkat. Dave wants to share some information about Dr. Venkat. David?
Good morning. I just wanted to take a couple minutes, or actually less than that, to introduce Dr. Venkat. I have known him for quite a while, and I can tell you that his advocacy on behalf of emergency physicians has been nothing short of stellar. And I can tell you that the experience he's had at the Capitol building, he has garnered a great deal of respect from both sides of the aisle when he was meeting probably more often than he would like to admit with members of the legislature on the issue of balanced billing. But I can tell you that whether it was legislative staff or members of the House or the Senate, they always respected what he had to say, often going back and forth between Harrisburg and Pittsburgh in a day to have one meeting on a particular issue. So I think that, you know, Dr. Venkat, when he is elected, will be a superb member of the legislature, someone who I think all of us should be very excited about because obviously having a physician in the legislature is going to be, something that's going to pay huge dividends in the context of his expertise. And I can tell you that there are members on both sides of the aisle who will look to him for clinical guidance on issues that they currently look to nurses and other non-healthcare related individuals in the legislature. So I'm excited about Dr. Venkat's candidacy. You all should be as well. And with that, I will turn it over to Dr. Venkat.
Well, thank you. Thank you, Dr. Balban. Thank you, Mr. Thompson. Thank you to the Medical Society for allowing me to join you this morning, and to all of you for taking time out of your busy board meeting schedule to allow me to speak with you. As Dr. Balban said, my name is Arvin Venkat. I'm an emergency physician with Allegheny Health Network here in Western Pennsylvania. And I am a Democratic candidate for the state house in the new District 30 with redistricting is one of the swingiest seats in the state. And so, like many of you, I got into advocacy because I saw the effect on my patients, and I saw how decisions that were being made in Harrisburg had a direct impact on my ability to deliver care. And from working with Dave and working with many of you, my go-to line when I was in Harrisburg as the PACEP president was, how is this going to work at 2 a.m. on a Saturday night when I'm caring for my patient, your constituent, on whom I know nothing about this patient, and I have to try and save their life? And that would usually give state legislators pause. And what really drove me to enter more formally the political arena was the fact of being on the front lines of COVID, both as a clinician, as well as I was president of PACEP at that time. And like the Medical Society, we had advocated for preparedness for years. We had advocated for investment in making our healthcare system more resilient, in first responders, in making sure that we did not run these vital public services at the ragged edge. And legislators and other political leaders would simply nod their heads and not do anything. And of course, COVID hit, my phone blew up, your phone blew up, everybody was looking for answers. And what it taught me was that the saying from Rudolf Virchow is very true, that medicine is a social science, and that in many ways, politics is an extension of that, and that we need to be in the political arena. And from the decisions that had been made by my local community leaders, and from hopefully helping them in making those decisions, I felt that there was an opportunity for the residents of the 30th district for me to be a unique and effective representative for them. The campaign is going extraordinarily well. We're obviously in the last few weeks, and PAMPAC and so many other medical societies have been very supportive financially of my campaign. And as humbling and gratifying as that is, beyond that, the voice of physicians in the Commonwealth and locally on behalf of my candidacy on so many issues that are front and center at this point, I think makes it clear that we as physicians, and hopefully me in particular in entering the state legislature, will have the opportunity to really advocate not only for the residents of my district, but for healthcare in general in Pennsylvania. And so that's my story. And I'm happy to answer your questions. But more than anything else, I want to say thank you, and to really say that if I'm elected, I will absolutely be a partner with the medical society, with the physician organizations in our state, with physicians and clinicians across the state, to try and improve the health of Pennsylvania, because I think our voice is absolutely vital to making sure that that happens moving forward, and that we learn the lessons from COVID to really understand how we can build a better healthcare system here in Pennsylvania. So thank you so much, and I'm happy to answer your questions.
We should point out that Dr. Venkat, Arvind, will be the first physician representative in Pennsylvania Congress since Bill Mazeroski beat the Yankees. I think it was in 1960 or something like that. Isn't that right? Something like the 61. So we're open for questions. Yeah, there's a few minutes to spend with us.
Dr.
Venkat. Oh, I'm sorry, Dr. Prey. Amy?
Thanks, Ed. Dr. Venkat, what are the issues that you see that are your primary focus once you were to be elected?
Yeah, I've campaigned on really 5 pillars from the beginning of this race. The first is investment in our vital public services, public health, public safety, and public education. This is, I think was the root cause of a lot of the challenges we had during COVID, and that we continue to pay the price for that to this day. Secondly, I think we've had a lot of people drop out of the workforce, and we've seen that especially in the healthcare workforce, and the impact that has had on our ability to deliver care. And I think it's a primary driver of inflation. We've also had a lot of people drop out of the workforce to care for aging parents, to care for children at home. So investment in making healthcare more affordable and accessible, getting more people into the workforce, particularly in healthcare, in-home care for the elderly, and child care, and addressing, the mental health crisis in this state, where we know that emergency departments and jails are unfortunately where we could turn in times of crisis, I think is absolutely critical. And then the last 3 pillars that I have focused on, I believe that we need to protect reproductive rights in Pennsylvania. And I understand that that is a very polarizing issue, but the concern about the criminalization of medical practice and the criminalization of clinicians, I think, is absolutely one where my voice and that of so many others is very important. Similarly, I think we need to pass gun safety legislation. I think it is a public health crisis, and that if it is the person and not the gun, we should be able to pass laws like background checks and red flag laws and safe storage laws that make a difference in terms of keeping guns out of the hands of those who've shown a propensity for violence. And finally, I think we need to defend our democracy. I'm an emergency physician. I care for those who often don't have access to care in other venues. And ultimately, their voice and the voice of my entire community needs to be heard through the democratic process. And I've said from the beginning of this race, if there is 100% turnout and I lose this race, I would be okay with that because that's how our democracy is supposed to work. I don't think I would lose this race if there was 100% turnout, but I think those 5 areas are what I have very much focused on in running to be the state legislator from the 30th district.
Morning, Wilson. Dr. Jackson?
Good morning, and Dr. Venkat, welcome, and we're thrilled about your candidacy and looking forward to kind of a working relationship going forward. Pennsylvania is not unique in terms of the consolidation in the healthcare industry and how that has, in my perspective, driven up total healthcare costs, particularly in the commercial payer sector. The consolidation that's happening, and there's lots of examples within our state how that's impacted care, or really the total cost of care. Any perspectives around that and things that can be done at either state or even federal level to try to kind of even the playing field, if you will, and to take the total cost of care, kind of drive that down to some extent? It seems like with these monopolies that are establishing or near monopolies that they can dictate the price of premiums, for example. So any perspectives or thoughts around that?
Yeah, Dr. Jackson, I completely agree. I think there's been a failure of government regulation in allowing this degree of consolidation, not just in the hospital sector, but frankly, in the insurance sector. We've seen it also in the clinician sector. I think that, I consider myself a capitalist. I consider myself a free marketer, but that is, we know from, decades of experience that unless government is willing to provide a framework for avoiding, competitive disadvantages in a variety of different ways, that we have failures in the market. And that's what we're seeing in the healthcare sector. In terms of what to do about it, I think you have to start with steps that empower groups across the board. So, in the clinician side, I've talked about restrictive covenants and the fact that, I think that restrictive covenants are very much an anti-free market intervention. I do think that we need to look at the market power that is being put forward by health systems that restrict the ability of clinicians and physicians in particular from being able to contract for their services appropriately. I think in the insurance sector side, we've all done battles with the insurance sector, and I certainly have the scars to prove it. In fact, one of the key attacks on me during this campaign has been on my advocacy on surprise billing. They conveniently leave out my advocacy in favor of legislation that would have ended surprise billing and done it in a way that does not disrupt the market, and attack me for opposing legislation that was frankly written by the insurance companies and would have decimated access to care. And we were on the same side on that. And so I think that we need to look at, the state backs up risk for the insurance system with the reinsurance program. Are those savings being passed on to consumers? I think not. And we're seeing that. I think your work on prior authorization, I think, is very important. And I think we need to avoid false solutions. I was very much in favor of the proposal from a few years ago that would have tested the idea that nurse practitioners somehow would fill the gap in rural Pennsylvania. I think we know from experience in other states that when full scope of practice is granted to nurse practitioners, they consolidate in suburban and urban areas and do not save costs. And we had a deal on that in Pennsylvania a few years ago. And of course, the nurse practitioners walked away from that. And so Dave knows this. I've been approached by legislators with healthcare backgrounds on this issue. And I've made very clear that I will be a voice and a vote to make sure that, it is physician-led teams that are the ones that are delivering care in Pennsylvania. And so I think those are some of the ideas I have. I think programs to get people back into the healthcare workforce are also very important to reduce some of these competitive pressures as well. I think at the federal level, there's the opportunity for, the Federal Trade Commission and the Justice Department to get involved in consolidation. I'll need to learn more whether the state can do the same thing.
Great, thank you.
Morning, Todd. Dr. Hertzberg?
Oh, thanks. Hey, Dr. Venkat, thank you so much. I do want to say that we consider it a privilege to have a physician running And I want to thank you for putting your name in the hat and stepping up. Please do reach out to us if there's anything we can do now or in the future to help you prevail. And just thank you for that.
Well, thank you, Dr. Hertzberg. I think the biggest thing at this point to help me is, the grassroots contact. My district has a significant healthcare workforce, a significant STEM workforce. Obviously, there's a large number of medical society members in Allegheny County who've been very supportive of the campaign. I think reaching out to your networks in order to say, this is an opportunity here, vote for this candidate, makes a big difference. If you're in Western Pennsylvania or willing to travel to Western Pennsylvania, we send out volunteers to knock doors every day. I've personally knocked over 10,200 doors in my district. My campaign has passed 15,000 doors. It is clear that this election is going to be close, but that I'm in a very good position to win. And, every vote will matter. And then, PAMPAC support, financial support has been extraordinarily important. And so anyone willing to contribute to the campaign, obviously, it makes a huge difference as well.
Morning, Dave. Dr. Sikos.
Yes, good morning and thank you. Could you please expand on your ideas about getting people back into the health workforce? And I can tell you that, this is just not, in any one particular area. This is regional, this is statewide, this is national. And I can tell you, being a chief medical officer in a hospital, the cost of replacing healthcare personnel, including, agency nurses and others, is just unbelievable. And in the face of decreasing reimbursement and loss of revenue, this is really affecting hospitals, again, especially those that are independent and in rural areas. Could you please comment on that?
Yeah, it's, I agree with you completely, Dr. Sikos, that this is a crisis. As Dr. Balvin mentioned, I'm on the board of the American College of Emergency Physicians, and it's a national issue also. I think there's a few things that we can do at the state level. I don't think any of them are a silver bullet, but I think they can make a difference. I think the first is we need to expose our students to careers in healthcare related professions much earlier. My district has 3 incredible public school districts, but one of the things they have not done a good job with is exposure to students of, non-traditional career paths, vocational career paths. And so I think that exposing students to nursing careers, to areas in healthcare professions earlier and showing that those are viable careers is very, very important. And we do have a track record of that in Pennsylvania on the union side with apprenticeships. And I know that Attorney General Shapiro has talked about this quite a bit, and it's something that I think we can build upon. The second thing is that when we develop programs in the state to incentivize people to join careers, whether it's nursing, whether it's radiology techs, whatever the case may be, there needs to be more accountability that those individuals are staying at the bedside, that this is not a program that, for example, gives loan forgiveness and you disappear into the ether, into non-clinical realms of practice. And so I think that is another important area that we can work on. And then the last piece is, and I had a forum about this yesterday with a group called Children's Action Fund. We need to recognize that the pressures here are not just within the silo of the 4 walls of the healthcare delivery system. When we're talking about the decimation of the childcare, workforce, when we're talking about the decimation of the elder care workforce, that is a spillover effect into our staffing of the healthcare system, because those individuals are leaving the workforce in order to care for children or care for aging parents. And so programs to increase reimbursement, I think, are very critical in those areas in order to get, living wages for those workforces. And I think hospitals and health systems are going to have to think outside the box a little bit in terms of those opportunities, more so than salary. Are we going to offer childcare options? Are we going to offer, options related to caring for aging parents or those lines to make a difference in the workforce issues. So those are three of the ideas I have. I'd love to learn more. I'm certainly open to other suggestions, but those are things I've talked about on the campaign trail.
And I see no other hands. Arvid, we're going to be knocking on your door in Harrisburg. We got some PBM issues and some champions we need. So, and a lot of other issues that are so pertinent, so relevant. Dr. Venkat, thank you for being with us this morning. Really the best of luck to you, and we will be knocking on your suite. Thank you very much.